Hello, and thank you everyone for joining us this October 9th for this advocacy webinar. I'm Nathan Kratz, Communications Manager here at Prevention Action Alliance. I'm with our Executive Director, Marcie Seidel, and the Manager of Administrative Support Services, JP Dorval. Just one moment, please.
Hey there, everyone. My name is JP Dorval, and as Nathan said, I am the Manager of Administrative Support Services. I'm happy to be here. I will be working with Marcie on a variety of projects ranging from administrative ones to legislative ones. So I'm ready to join the team and get some good work done. So thanks, guys.
Good morning, and welcome again to our advocacy webinar. It's a delight to be with you on this beautiful October day. I'm very excited to have the newest member of our team with us today, who will be working side by side to help us do the good work that we do and to encourage advocacy throughout the state of Ohio. So we're just delighted to have JP join our team. So thank you for being with us today. We have a couple things that we're going to start out with. The first, of course, is issue one. And issue one is coming down upon us very quickly. We're only about a month out from the election. And this is what we believe at Prevention Action Alliance is one of the very most important things that we encourage all of you to dive into, to look at, and to understand. Prevention Action Alliance, up on the screen right now, you will notice that we have a statement from us that we have put out to our team and crafted that says basically that we do not support this initiative as it stands, and that we instead implore that the Ohio General Assembly seek bipartisan legislation solutions to adequately address the incarceration of nonviolent offenders with substance use disorders. And we believe that, we also indeed believe that this is that people should, if they so are led, to not vote for this particular initiative. We have several things that we'd like to bring up and discuss about why we have taken that stance. One of the key pieces about this is that anything in a ballotative initiative like this is like doing surgery with a chainsaw when you actually need a surgeon's scalpel. And when something like this gets put into the Constitution, every piece of legislation known to man has never been perfect when it's been instituted, so it also always needs to have a degree of fine-tuning and taking a different, closer look at when things have unintended consequences from it. And when something like this goes into a ballot initiative, you can't do that without spending millions of dollars to do that, to have another constitutional amendment to change it. Therefore, legislative action is the best way to do it. And I know there are many people that believe that the legislators have not done a great job of addressing this issue that we all feel is important, because Prevention Action Alliance resolutely believes nonviolent individuals with substance use disorders should receive treatment and for their disease instead of incarceration. We truly believe that, but we don't believe this is the mechanism to do it. When we put it into the legislative hands of our legislators in the State House, they have the opportunity to study this in the detail with the experts in the field surrounding them to give them the advice and the testimony that's needed to make this the best possible legislation whatsoever. Individuals who are voting on November rarely have the opportunity to read the 2,000-word initiative let alone understand it. They don't even have time to read it. So they're getting the sound bites, which come from people that feel that they have a very strong interest in it. So we encourage you to do what you feel is right, but here at Prevention Action Alliance, we believe that this is not the way that it should go. What this particular proposal does, it makes the 4th and 5th degree felony of a drug possession, changes it to misdemeanors. It prohibits jail time for misdemeanor possession cases until a person's third offense within 24 months. It allows people previously convicted of a felony drug possession to petition courts to have their changes reduced to misdemeanors. Required sentence reduction as much as 25% for prisoners who work for participation in rehabilitation programs. And those convicted of murder, rape, and child molestation would not be eligible for this. But well, we can go back through this. But there's a lot of other crimes that are just that are violent that don't fall within those three realms that would be allowed off of the hook, so to speak. It requires judges to take another step before sending probation violators to prison, and it puts savings from the reduction of prison population into state-administered drug treatment and crime victim programs. Having said all of that, there's good things to discuss that would say that these things won't work quite as well as it sounds on paper. And we know that savings never come in as it's predicted in legislative matters, as we look at a variety of different things. They've never come in. We feel this undermines the drug courts, which we feel are incredibly good at meeting the person where the person is and moving them systematically through a system, keeping them accountable for their recovery. And when they are non-compliant, then the threat of incarceration oftentimes helps that individual go across that threshold to make sure that they get into the treatment that they seek and want. So lots of things about it. We'll be glad to discuss this with you and provide you more information about it if you so desire, and discuss with questions at the end of it. But we felt it was important for all of our friends to know where Prevention Action Alliance stood on this, and that we have an official statement about it, and we'd be glad to share that with all of you if you would like it. The next thing that we want to discuss very briefly is that you all know November 6th is voting day, and we're encouraging everyone, no matter how you view things, is to vote. That's the most important thing, most important right and responsibility, as I believe, that we all have. And so we encourage you to do so. An informed voter is good government. We also want to just kind of give a foretaste of what we're looking for in the future. As the new governor comes in at the end of November, we are getting ready for a new biennium budget, which will start with a new General Assembly in January. One of the things Prevention Action Alliance would do this year is to be, as we have in the past, but even more so with the fact that we have JP with us, will help us with the ability to do that, and that is to look more closely at the biennium budget. We have to educate our legislators about the importance of prevention, and while I think they all understand the importance of prevention, I don't think everyone understands everything about prevention. Too many times they totally view prevention as just saying no, or harm reduction sort of measures. And I think it's important for us to encourage them to understand and support and fund universal primary prevention. As we go further upstream, we will be able to save more costs as we go downstream into the epidemic and the crisis we've had later. So we need to get in the front of this crisis of addiction that we have in the state of Ohio and in the country. And so that will be upon us to do that. We have put together a white paper that talks about 3 areas that we want to do where it's sustained funding, not only for prevention, but for the workforce in the prevention area. We are looking at school and education-based prevention services. Certainly community-based collaborations are important. And then, of course, our youth-led prevention. And that covers really a wide spectrum within a community of how we get good prevention handled. So we will be promoting all of those things. And then also we want to go along with what we just talked about with issue 1, and that is to look at reforming the laws about treatment and incarceration, and to strengthen our drug courts and other mechanisms that are available to help people that are struggling with this disease. So keep tuned for that. We will be reaching out. We would love to have anybody who is inclined and enjoys that kind of work to reach out to us, and we'll include you in our travels to the State House to educate legislators, and be glad to meet with you as you go visit your legislator to help promote these areas. So let us know. We are looking forward to a very robust year coming up in advocacy work. Wanted to update you very quickly that, and we have done that in the Legislative Weekly, a legislative update, that H.R. 6 at the federal level has been passed by both the U.S. Senate and the House of Representatives. It's on its way to the President's office now to be signed into law. This is one of the most comprehensive packages that has come along in our field, and especially for the opiates and the disease model in a long time. And we appreciate all the work that has been done on this. As we look through it, there are many components in it. We've been sending that in the legislative update, so we encourage you to go back and take a look at them. But in those that opiate package, there's health care integration, there's treatment capacity expansion, treatment workforce expansion, medication-assisted treatment. There is recovery supports within the package. There's helping moms and babies, lots of initiatives within that. There's helping patients and families in crisis. Law enforcement has been addressed in that package, as well as prescription medication and safety disposal. So it has reached many, we also have prisoner reentry in it as well. So it's really across the spectrum of the many varied things that it treats, but there's only one small little thing in it. While there's certain environmental prevention pieces within it, but when it comes to prevention, solid, just prevention standalone, the only thing it really talks about is the Drug-Free Communities Reauthorization Act, which is incredibly important. And that piece of it is that they were putting more money into that, and we know that, and we are delighted for it. But here's a good case of what we're saying about moving forward, is that we need to increase primary universal prevention so that people understand before we get to the point where we need packages like this, that we stop a lot of this disease that's happening in our country. Also within this bill, the high-intensity drug trafficking areas, or HIDA, is being reauthorized in this, as well as the Office of National Drug Control Policy. So we're all extremely thankful for all those things, and extremely thankful for all of the work that's being done in this package. But our work is in front of us to encourage and educate about the importance of prevention in the primary states. Okay, our medical marijuana control program is still moving forward, and we will see it kick into gear here. As we all know, it was supposed to be up and running on September 8th for a variety of reasons that were really no fault of any one item. It hasn't been up and it hasn't been moving, but as you all know, I sit on the prevention, or the Medical Marijuana Advisory Committee. And so we have been kept up to date about the things that are going on, and it's from lawsuits to local zoning laws to local legislations. There's all kinds of things that have entered into this that has slowed the process down. And I've said many times before that I believe trying to get a massive industry like this that has been illegal to this point up and running within just 2 years' time was a huge undertaking. But I think that it's on course and it's going to happen. We have 26 individual cultivators that are licensed that will be growing marijuana in the state of Ohio. Right now, 2 of those smaller ones have reached to the point where their crops are ready to be harvested. And so in the month of November, we will have product that will immediately go into the dispensaries. We probably will not have processing plants accepting immediately any of that marijuana, because we're just trying to get the marijuana up and growing, and so that patients who have been wanting it and needing it can get it right away. So it'll be the dried flowered piece of it that will be going into the dispensaries to the extent that we have it. At the end of the year, the larger cultivators will be able to harvest their initial crop, and some more product will be available that will be going into the processors to be put into various things of oils and tinctures and foods and things of that nature. So watch the evolving medical marijuana control program take off here in the next few weeks and continue to grow as everything starts to come together with the licenses. We have just some of the notes from our advisory committee meeting last week that I will share with you. Right now, the patient registry is not open for a variety of reasons. One is that each card that is given to a patient or a caregiver is only good for a year. So until we have product available, it makes no sense to give the people a card only to have a card that's going to not provide them with what they need and then expire within the time period of a year. So we're waiting until a closer time that individuals can receive those cards, that it can correlate more directly with the product that will be available to them. And I guess there's another piece of that, the affirmative defense piece that's in the state of Ohio right now. Once those patient cards are started to be issued, that ability to use that defense goes away. So that's what the timing of all of this is. They are also looking at this part that the pharmacy board is looking at reciprocity with other states, so that individuals, when they travel, might be able to go into states that have marijuana programs, might be able to use their cards there, and likewise here in the state of Ohio. It's been an interesting, according to the department or the Board of Pharmacy, is that it's not as easy as it might seem or we might hope for. Right now, the only state that is actually in active engagement and conversation with the state of Ohio is Michigan. Being a border state, that's probably a very significant thing. But things like this get tied up in what each law of each state reads. It gets tied up a little bit into the federal government, which is still an illegal substance. It gets tied up with a lot of attorneys on both sides of the borderline trying to negotiate how best to do things. So it's a slow process, but they are working on it, and they have reached out to every state that has a medical marijuana program, and we'll see what they can do with that. They are right now in the process of licensing employees that will go into the dispensary, so that's taking place. We know that the dispensary is up and waiting for product in Columbus, Ohio. We have seen it on Broad Street in Columbus, Ohio. So I imagine other communities have dispensaries that are getting ready to accept product into their facilities. We have, as far as the cultivation piece of it, there are 10 of the 26 certificates that are in the process of growing their products right now and ready to be in full operation. The other 16 of those individuals that are in licenses are working through all of the processes that they need to meet the standard qualifications to get their license and open the door. We've had, as far as processors, we've had 14 provisional licenses that have been issued, and so we have 14 that are getting ready to start the manufacturing or process. There will be another 26 licenses that will be issued, but we're waiting for a second round of those to receive their licenses. There were 104 licenses for applicants for the 40 licenses for processing, and only 14 of them met the qualifications in the initial round of licensing. So those 14 have gotten their licenses and they're moving forward. The others have to resubmit, and they're resubmitting under the area of security because all of them fell short in the security area. So they went back and had all of them redo the security piece of it so that they fully understand the importance of security and what's needed. And therefore, when those come back in the next week or two, they will continue the scoring of the additional people, and then we'll complete the 26 and issue the 26 licenses that are still outstanding. We have testing labs. We have 5 that have been awarded in the state of Ohio, 2 public universities and 3 private ones. We can have as many testing laboratories as possible. So when it comes out of the cultivation, it will be, if it doesn't go to a processor, it still will go to a testing site so we know exactly what the THC level is, make sure what the what the pesticides and the fertilizers and all of those types of things are within that product to make sure that everybody knows that they are meeting the safety level that we want them to, and people know what they're ingesting when they take it. So those are up and running, and they will be ready to go forward when the product hits the market very, very soon. We have 293 CTRs, which are physicians that are certified to recommend. So if you have a physician who has their credentials, will be their MD or their OD behind their name, and then if they have CTR behind that, you know that they are capable of recommending marijuana at that point. Each month, the medical board meets, and they accept applications each month and review them for individuals that will go forward with this CTR process. And so there will be more coming each month, but currently we have 293. So that's kind of where we are at the medical marijuana at this point, and we are looking for keeping you updated about it as we move forward.
Thanks, Marcie. We actually got a question that I think really bleeds into our next slide. Cecilia Yelton wants to know if there's an updated medical marijuana presentation that we've created that we could share, that they can share with partners in their community.
Yeah, actually, Fitting Sessions went on it on Sunday night, so that's pretty up to date. So yeah, I'd be glad to send that out to individuals so that they know what the most current up to date information is. So yeah, we'll be glad to do that. One of the other things that's happening at the advisory committee at the state is that while we went through the process of looking at the legislation, then looking at the rules and reviewing all the rules and making recommendations, we are now in the stage of where we're going to the next phase of what's happening in the marijuana control program. And that phase is to understanding the difficulties, the unintended, unexpected consequences, the things that happens that actually transpire once we roll this out. So we'll be looking at a variety of things. One of the things that we'll be looking at on a very detailed level, where we'll bring in experts to talk about it, discuss it, to figure out what problems there will be. And we want you to participate in helping the state to understand what those things are. So if you have something in particular that you're concerned about, that will be happening in your community around this, and we need more information and we need more studies about, would you please email those to me or to JP at Prevention Action Alliance, JP Dorrell at preventionactionalliance.org, or me at Marcie Seidel or M Seidel at preventionactions.org, what those concerns are, and we can take those to the committee and have them looked at, and chances are those questions are already there, but as soon as we get more information to help you, I will know exactly who to get that information to while we share it with everybody, but we'll make sure that individuals who are interested get that information as we come up with it. So please do that. That'd be a great way to get involved and help us to understand what your concerns are in your community as this rolls out, and what those unintended consequences, unintended things will happen in your community that we want to make sure get mitigated before they're big problems. All right, the last thing that I just want to mention that we found that came out of a study that happened in the University of Montreal, which we thought was really very interesting, because so many people along the way as we do our prevention work want to engage with us about the fact that marijuana is safer and better than alcohol, and that we should legalize it, which is we know is coming. This study, I think, is important for us to note, and that is that a study was done on a population-based analysis of the relationship between substance use and adolescent cognitive development. And in this study, they found that cannabis has worse effects on the adolescent brain and more long-term impact on skills, memory, and behavior than alcohol does. So suddenly we're looking, and we've always looked at, we want to delay the onset of use for any young person as long as we possibly can. And now we have good additional data to support our premise that we need to keep our young people away from marijuana and alcohol, but then in fact, the argument that marijuana is better than alcohol no longer plays into young people's piece of this. So we want to just share that with you and let you know that that research is out there. We can send you a link, and I should have done that on the slide, but we can share you a link to dive in and look a little bit more about that research. So anybody that finds good research, things like that, we encourage you to share that with us, and then we can share that with others. We're all in this together to make sure that we have healthy young people and safe communities. Okay, Nathan, do we have any questions?
We do have one more question. It's from Andrea Smith, and she was asking to know what the process is for reporting someone that is selling CBD products. As we know, in Ohio, those are still illegal. The Board of Pharmacy has made that very clear. Is that call the cops or call the zoning board kind of situation?
Yeah, I've asked this question with the Ohio Board of Pharmacy, and they indicated to me that this will be a challenge for us, but they indicated that they would like to know that. So I would call the Ohio Board of Pharmacy and let them know what's happening and where it is. And I think they're going to be looking at ways. That's one of those unintended consequences, things that we're coming up against. Probably law enforcement's not going to go in and do much about them, but we want to get our handle around it, because as the enforcement of the new policy comes out for the marijuana control policy or program, is that all of it has to go through the system in Ohio. So eventually, as we know about these things, they can find ways to make sure that those individuals get stopped and that the process is exactly what the law states in the state of Ohio.
All right, thank you, Marcie. I don't see any more questions. It is past 10:30, so we will be ending the webinar. Thank you again for joining all of us, and we greatly enjoy your questions. Don't ever stop sending them in. Please email them to Marcie. Her email address is there on your screen, or you can email them to JP at jpdorval@preventionactionalliance.org. That's also on a previous slide. You'll be able to see them with the recording. Thank you all for joining us.